today I'd like to go over some information with you about hysterectomy, some information that will be helpful for you as you prepare preoperatively, and information for you postoperatively. I do have, and we will be giving you a handout that you will be able to also refer to on your own, but I would like to touch base with some things that we feel are very useful for you. When we go through this, we'll have set up your appointments for you, and you'll talk with Dr. Cohn about the procedure itself and what his plans are for you at that time. One of the first things that we'd like for you to know is that there are some medications that we do not want you to take as you're preparing for the surgery. One of those is aspirin, Motrin, or Aleve, and that is because it does contribute to some, or possibly could do to some heavy bleeding during and after the procedure. If you're on any diet medications, any herbal medications, things that are over the counter, we would need to know about those. Also vitamin E, a capsule that many people take, also contributes to bleeding. What we do want you to take is, if you're having back pain, headache, anything of that nature, is Tylenol to take care of that discomfort. If you should catch a cold or have some type of problem that you feel like may keep you from having the surgery, please call the office as soon as possible so we can address that. Also, before the surgery, the day before, you'll be on a clear liquid diet. That diet is basically just as it sounds. Anything that you can see through, you can have. No milk products and no cream soups. So you broth, consomme, hot tea, coffee, all of those things, if you're really hungry, will kind of help tide you over. Plain Jell-O, popsicles, fruit ice, ices, the day before surgery, you'll also be doing a bowel prep. That information is in the paperwork. What we use mainly is citrate of magnesia, which is over the counter. It's a little 10-ounce bottle of pop that really doesn't taste very good, but it is easy to go down. And also 4 Dulcolax laxative tablets. You'll do that around 5 p.m. and then follow that with just lots and lots of water. That'll kind of help that go through. And our goal is to have your bowel movements come back clear, so that by the time you go to bed, everything has kind of cleaned itself out. Also, if by the time you go to bed you haven't cleaned everything out, we like to follow the citrate of magnesia with the Fleets Enema. It's over the counter also, and we'd like for you to purchase that. You may not need that before surgery, but sometimes after surgery it might be necessary to use that. The night before surgery, we also like for you to use a good antibacterial soap like Dial or Lever 2000, and just scrub the whole abdominal area very, very well, and also clean the belly button with hydrogen peroxide and cotton swab, and just clean that area well. You can also, if you would like, shave near the pubic hairline and clean that up if you would like. And nothing to eat or drink after midnight. So from the time of your surgery, many times if it's in the afternoon, the anesthesiologist will let you have clear liquids early in the morning and then nothing 8 hours prior to the surgery. As we're getting to look at post-operatively how you recuperate, the one key factor that we do want you to know is that, of course, the first day or two after surgery, you're going to feel like you've had surgery. You're going to be sore, tender. You will recover from the anesthesia as it leaves your system. But every day should get better and better and better. So usually by about the third day, you're feeling pretty well. You're eating regular food with the family, and actually starting to feel like a human again. Let's just say that you've passed that and you're 5 days out of surgery and you'd been doing very, very well, and then all of a sudden you start feeling more pain, discomfort, start throwing up. This is not normal, and we would certainly want you to call the office and let us know. One of the first things that we like to address after the surgery is, especially if you have a procedure that's laparoscopic, a CO2 gas is used to fill the abdomen so that the surgeon can see what he's doing, so Dr. Cohn can take a look at what is there. After the surgery, he compresses as much of that out as there as he can, and sews, of course, everything back up. The first day or two after surgery, you might feel a lot of fullness and tightness up in your shoulders, and that's really from the gas as it moves up in there. It's absorbed into the tissue. It's really not anything that's in the stomach, and so it does take a little while for it to absorb. Usually movement will help, getting up, walking around, laying on a heating pad, changing positions, all of those things will help. But many patients will say that's sometimes one of the worst parts of the surgery. During the surgery, you will also have a catheter that's inserted into the bladder, and this is to keep the bladder out of the surgical field. And most of the time, if you have this in a day surgery type of procedure, they will remove the catheter before you get to recovery room. And then we'd like for you to try to urinate or to void before you leave. But if you cannot, we typically like to know within 6 to 8 hours whether you're able to urinate. Now, you may start and not be able to empty your bladder completely, but if you're able to go little bits by little bits by little bits, and you're not too distended and not too uncomfortable, we can follow that. But let's just say you get, and it's 8 hours after surgery, you're home, you cannot go, you just have sat and you cannot do that. You need to call the office and let us know so that we can make arrangements to make you more comfortable. A lot of times that means coming into the treatment room at the hospital and having the catheter put back in, which the next day typically we can give you instructions to remove that. After surgery, you might have some bleeding or discharge. If you keep your ovaries with the hysterectomy, sometimes you might have a little bit of bleeding around the time that your period would be there. This might happen for up to 4 to 6 months, but if this continues after that time and it's more than just a slight nuisance, you need to please let the office know. With the procedure, have to heal there wherever the cut has been made from the uterus and the cervix. So that area is kind of like having a scar as it heals. If you scraped your knee, it might have some little oozing, little discharge and everything as it heals, and this is very normal. That can last up to 6 weeks after surgery. That is very, very normal. But if you have a foul odor or something just doesn't seem right, you have a lot of pain, always give us a call. We will have you come in and have